After reviewing the details of her case, I think that Frida should have another opportunity for a kidney transplant. I think this for many reasons. First, I think it's just the most ethical thing to do in this situation because you have a chance to save a life potentially. And Kant would also believe this with his duty-based ethics. He believes that if you can save someone, you should save them, and it's your moral obligation to save them if you have the resources. And it would be treating her as an ends to herself, which is what he believes in. And it's also important to note that Frida was harmed by the hospital error and not by her own actions. Ignoring her now would mean treating her as merely as a means to uphold policy rather than respecting her humanity and dignity. From Kant's view, the moral duty is to act justly and try to correct the wrong, even if the outcomes aren't 100% sure. At least you could live with the decision. Mill's utilitarianism also would agree that she should have another opportunity for a kidney transplant. Mill focuses on maximizing the overall well-being of the greatest number of people. Denying Frida could lead to her death, which would be a tragic outcome not only for her and her family, but also the mental health of the staff at the hospital, knowing and having to live with the guilt that they kind of like were responsible for her death. Providing another transplant could also save her life, and not only that, but it could also restore public trust in the healthcare system, showing that the hospital is going to step up when they make a mistake and not just abandon patients, so the public could trust them a little more if the situation occurred again. Even though the situation is risky to do another procedure, the potential good outweighs the harm of the inaction. Policy is also important for fairness. The counter argument would be that there's other patients on the list who need a transplant, so why would we give her two instead of give the next person in line one? Because they've been waiting their turn and doing things the right way. But I think applying that principle here would not be the right action because, like I said earlier, she was harmed by the hospital's error and not her own self. So I think the guilt that the hospital staff would have to live with would be a valid reason to move her up in the rankings, I guess you could say, or like prioritize her for another action because she kind of needs it now, and she needs it now, otherwise she'll die. So for those reasons, I strongly recommend another transplant, because it'll not only create the greatest number of good for the most people, but it also would be the duty-based ethics in doing what you're supposed to do, technically.